All right, so have you been, so this video is going to be about the simplest and easiest way to inject testosterone, where to do it, why to do it, and it not hurt and you not need anybody to help you. Like many people, I was diagnosed with low testosterone. Mine was like 209, I believe, and all of the normal symptoms. So a lot of these doctors, I mean, they're just vague, and some of them just don't even know. So after I've been doing it for like a year, well, not quite a year. And so after some experimentation, talking to other people, and I have come up with what I think is the simplest way. And a lot of people are still trying to do it in your glutes, or some people's doing it in their delt, and other places. And to me, it's just aggravating and painful. So what and again, the people do different needle sizes, people do different locations, and what I'm going to share with you is what I have found to be the simplest and least amount of pain and or pain-free way to give yourself the injection, and just quick, fast, and simple. So here we go. We've got a syringe. I use, this is straight from CVS. Obviously all this is prescription. I have a prescription. These are 25 gauge by 1 inch. This is what we inject with. So we're gonna get this baby opened up. All right, and then I have an 18 gauge tip to go on, and this is what we draw out of the bottle with. So we got that laid out. This is your standard 200 ml, 200 mg, milligrams, milliliters. So there's 200 volume and 200 of the milligrams of testosterone in this. So we take the safety cap off. Everybody's prescription is going to be different. What I started out at a really low dose, and then I always take alcohol, and we clean the top just cause we don't want to take no chances. I started out with a really low dose, and then we constantly monitored my levels till we got up to like 200, the whole bottle every week, and then mine got high, and then so we had to bring it down. And I think now I'm doing half a bottle, 100 ml, or half a cc. I believe that's half a cc every 5 days. So I get 3 bottles a month, and I take, because the thing that nobody tells people a lot of times, I mean, maybe some people do, but everybody I've talked to, they have no idea if they're going through a doctor, is the more frequent you can take the dose. So small dose, more frequent than big dose spread apart, your level is going to stay more like this instead of up and down, and that's not what you want, because then you have those symptoms, and then when you take a really high dose, it makes your body want to make estrogen or estradiol. That can come on easier. So if you can keep low doses more frequently, some of those problems alleviate. So I take the small tip off. We put the 18 gauge tip on. We're going to take our bottle, and we're going to turn it up. I don't know if you can, hopefully you can see that. And then we'll just insert the tip, and then we're going to draw back, because with the big tip it'll come out, and so that's already done pulled more than I need. And so we're going to come back to roughly that half cc, and then we're gonna pull out. All right, we'll take our big tip and we'll put the cap back on. We'll pull that tip off, put your small tip back on, and then we take it off here. And air is not, so you're not injecting into a vein, you're going into a muscle. So if you get a little air, it's fine. I mean, it takes a lot of air to kill you. I mean, some people think just one little bubble and you're gonna die, but that's not the case. But again, you're going intermuscular, so if you injected the whole thing of air, it might be sore, but it's not gonna hurt you. But still, I get the air out. So I just hold it up, you know, and just visually try to look and make sure, you know, you thump it around, and usually the air will just work its way out. You'll see the bubbles, and I like to try to get the air out just because I don't want it to. I'd say we're looking pretty good there. All right, so we're gonna close that back up. And then I generally alternate legs. You know, this leg this time, the next leg the next time. What I have found, so again, everybody's different and everybody can do whatever they want to do. But what I have found is the quad is the least painful place to do it. Plus, if you're doing it yourself, it's right here in front of you. You just do it and move on. It's not a big deal. I was doing them in my glute to start with. That's what the doctor told me to do. And every time it was just painful and sore, and my wife had to do it because, I mean, I can get back there, but I can't see, and it's just awkward. And, you know, so she was doing it. It was painful. And at some point, somebody told me, you know, do it in your quad. It's just so much simpler. And so I'm like, well, shoot, you know, yeah, that makes sense. So, you know, you got a huge, I mean, you know, most people have got, you know, a large quad muscle. And so it's right there. You don't have to go deep. We use a 1-inch needle. Everything's easy. So I'll get a fresh alcohol pad. I mean, these things are so cheap, just, you know, and we'll clean the area good. Keep in mind, it's the drying of the alcohol that kills the bad stuff, so make sure you let it dry. And then I find that you know, to the left, so the outer side of the quad, and generally, you know, the upper 2/3 is where you want to be as far as the injection goes. And to keep in mind, this is oil. It's oil based, so it's thick, and we're trying to put it through a 25 gauge needle. So it takes a little effort to push it out. So if your house is, you know, if you keep it, you know, like Antarctica, it's going to be harder to inject than if you can have the bottle slightly warmer, you know, if you can leave your testosterone in a warm place. But all right, so we're ready. So I just keep my leg relaxed, and then what I do generally is I'll just spread the skin apart before I do the injection. Spread the skin apart, and then just boop. I mean, you don't even feel it. And then that's literally all there is to it. Generally, because again, it's oil, so I'll just rub it to help it, you know, go into the muscle. And sometimes you can get just a little bit of blood, but for the most part, they rarely bleed at all. And I mean, it's almost, you don't even feel it go in. So what I find is some people are on, you know, like a once a week or once every 10 days, 200 milligram, the whole bottle. What happens, because I was too, what happens is when you put that much oil in one place, it makes it sore. It makes the muscle sore. And some carrier, they call them carrier oils. Some people are more susceptible than others to injection site pain or soreness. And generally it's not from the needle going in, it's from the oil. So they make testosterone with a couple of different carrier oils. So, you know, if you get in one kind, if your prescription is whatever brand it is, and you have pain after the injection, then you want to talk to your doctor about, you know, let's try another brand. This may be a different carrier oil, and you may or may not have those injection site pains. But I do pretty well. I mean, I would say 1 out of 10, I may have some injection site soreness, but for the most part, especially now that I'm doing a half a cc every 5 days, it's way better. Rarely do I have any injection site pain or soreness or any of that kind of stuff. So hopefully that is helpful. And because like I say, I see it on a lot of these you know, forums and stuff. People are asking, you know, I just got prescribed testosterone, you know, where do I inject, how do I inject, all that kind of stuff. And I was the same way, because the doctor's like, oh, just put it in your glute, you know, and I'm like, how am I gonna do that? You know, I mean, it's just aggravating. And so a lot of times they just don't give you a lot of insight. So some of this stuff you just kind of have to figure it out on your own. And luckily, you know, we have an outlet on YouTube to be able to put this stuff out there and hopefully help somebody else not have to go through all the nightmare that, you know, some of us did go through. So hopefully that was helpful and or entertaining. And you know, just stay on top of it, and it's a great thing if you use it the correct way. Thank you so much. We'll see you on the next one.